All right, everyone, welcome to today's class. And today we're going to be talking about medication administration for nursing students, and we are just going to be dealing with simple and NCLEX focused basics. So, what is medication administration? Well, this is the giving of medications to a patient in a safe and correct way whilst following the doctor's prescription. Yes, the doctor will tell us what route or what dose or what type of medications we are to give to this patient. But as nurses, we are to have a basic understanding, not just basic, in fact, full understanding of medications as a whole. So, now, what is the importance of safe medication administration? One, nurses must give meds safely to avoid causing harm. You must not cause harm to your patient. Another one, medication errors can be dangerous or fatal to patients. Yes, if you give a wrong dose or a wrong medication in total, it can become so dangerous to that patient. It could even lead to the death of that patient. And how can we avoid this? By following the third instruction on this video. Follow the 5 rights every time to administer drugs. So you would ask, what are the 5 rights of medication administration for the new nurses? While our pros in the house, we already know the 5 rights. 1. Right patient. 2. Right medication. 3. Right dose. 4. Right route. 5. Right time. Although there are so many other rights too that are now being added to these 5 rights. So many researches are being done, give safe medication administration. There are also other rights we nurses have to follow. Even the doctor too themselves have to follow. But we're going to be talking about these 5 rights now. 1. Right patient. Always check patient ID band. Always check their band, the bands on their arms. Always check it. Ask the patient to state their full name and birth date. As the patient is stating their full name plus the ID band that you had checked, you would now confirm it with your MAR, which is the medication administration record that you have on you. You confirm that, oh, this is the patient's name and this is the patient's date of birth, to avoid giving a wrong medication to the wrong patient. 2. Right medication. So always check the medication label in order for you to get the right medication. Always check the label. And we have 3 times we have to check this label. 1. When taking it from the shelf. 2. Before preparing the medication. And C. Before giving it to the patient. Always verify that the medication name matches the order, matches the prescription the doctor had given. 3. We have another one, the right dose. The right dose. Always double check the prescribed dose. Did they say you should give 1 milligram to this patient? Or did they say you should give 2 tablets to this patient? Or did they say you should give 1.5 tablets to this patient? Always double check the prescribed dose. Use the correct measuring tool. And if you're unsure, always ask a pharmacist or a senior nurse at hand. Number 4, right route. Confirm how the medication should be given. And we have so many routes of medication. We have the oral, parenteral. The parenteral means IM, IV, sub-Q, ID. IM means intramuscular, which is maybe you give it to the buttocks or to the thighs. IV means intravenously, whether you give it through the veins. Sub-Q means subcutaneously, so we'd give it to the subcutaneous part of the skin, while ID means intradermal. That means we're giving it to the dermal part of the skin. Then another form of medication route is topical, which is on the skin, that is the epidermal part of our skin. D, inhalation, just like those that maybe they're having asthma attacks, they will give them their inhalation pump to inhale the medication, while E, sublingual and buccal. Just like if we can remember our nitroglycerin medication, they normally say the patient should put the tablet under their tongue. F, rectal. So we have suppositories for that. G, vaginal, which is into the vagina. H, intracranial. And another thing to note, please do not change a route without an order. If they had not instructed you to change the route, formerly the patient was given through orally, and they have not instructed you to give this patient IV, do not give the patient IV. Do not change a route without an order. 5, right time. Always give the medication at the prescribed time. Remember that the drugs work with time. There are some drugs you will give daily, once a day. There are some drugs you give every 8 hours. There are some drugs you give every 12 hours. There's some drugs you give only when needed. So you have to know the time you are to give these drugs, and also know when to hold or delay medications. This is when you should have a proper knowledge of your pharmacology as a nurse. So, what are the additional rights? Remember earlier we had talked about there are other rights that researchers are trying to add to the five rights that we have. I made mention of three more. There are so many, but these three: one, right documentation; two, right reason; three, right response. Right documentation is we have to record everything we do after giving medications to these patients. Always record. Always record what you have given, the medication you gave, the dose you gave. Always record. Two, right reason. Understand why this med is being prescribed. When you have looked at your patient folder and you see that okay, your patient is a child, a 2-year old, and the medication being prescribed to this 2-year old is aspirin, you would know that no, this aspirin cannot go. Then you refuse the order. You call the doctor or you call the senior nurse at hand to show them so that the doctor can correct this prescription, or the senior nurse can call the doctor's attention to correct this prescription. Another one, right response. Monitor patients for effects and side effects. You know that most of our drugs have side effects. When you have given this drug to this patient and you see that, oh, this patient may not be breathing well, or this patient is feeling so nauseous, or this patient always vomits after taking this drug, you would know that, okay, this drug may not be fit for this patient. Then you call the doctor's attention so that they can prescribe another medication that would be much more better for the patient. Another one we're going to talk about is the key safety tips. As a nurse, what are your key safety tips you have to make sure you follow so that you can make sure that your patients are not come in harm's way? One, wash hands before and after medication administration. Always wash your hands. Cleanliness is next to godliness. Two, explain medication to patients in simple terms. Do not use your jargons, your medical jargons, to explain to these patients. Always explain to them as simplified as it can be and make sure they understand. Another one, never leave meds unattended. Another one, dispose of sharps properly. Make sure your injections, the syringes, the needles are disposed properly. When after giving medication to your patient, would you drop the sharps on the floor? No, you will put it in the sharps box. We have that in the hospital. So, common medication errors. There are so many medication errors, but I gave the simplest of them. Giving meds to the wrong patient. You did not confirm the patient's name. You did not confirm the patient's medication. You gave the wrong med to the wrong patient. Another one, wrong dose or wrong time. Instead of you giving 1 ml, you gave 1.5 ml, or you gave 1.2 ml. It is still a wrong dose. Another, wrong time. You are meant to give this patient this medication by 2 p.m. and you gave this patient by 2:30 p.m. That is a medication error. Another one, skipping allergy checks. Yes, you know that this patient is allergic to maybe penicillin, and you went ahead to give this patient ampicillin. This patient is going to react to the drug. You have skipped an allergy check, thereby causing medication error. Another, not monitoring patient after administration. You gave this patient this drug and you did not wait to check. Are there any adverse reactions that's going to happen? You just left. And maybe the patient then entered suffocation, whereby maybe the drugs was causing the lungs to be shutting down and you had left. This patient may end up dying. And you are going to be taken to jail with your license revoked. Now, let's do a very brief summary of what we have talked about. One, always follow the five rights of medication. Two, stay organized and focused. Do not go into the word with your mind elsewhere. Another, ask for help if you're unsure. There is no shame in asking for help if you're unsure of something, because you are dealing with life here. You are not dealing with Mr. Jones or Mrs. Jones. This one, you are dealing with a real life that can be taken because of a medication error. Another, patient safety is the top priority. Yes, always make sure your patients are safe in whatever you do as a nurse, as a student nurse. Thank you for watching. Make sure you access the quiz at our site, which is nursingwithcharity.com.ng, and like, subscribe, dear nurses. Bye.